My topic for today is jaundice. Um, so what is jaundice? Jaundice is the condition characterized by abnormal yellow pigment present in skin, whites of eyes, and mucous membranes, and it's caused by high levels of bilirubin present in blood. And what is bilirubin? Bilirubin is the yellow pigment and the byproduct produced when the liver metabolizes the old red blood cells. Typically, the liver filters out the bilirubin and excretes it in the bile, which is then passed out of the body through stool. However, when there is a complication with the liver or the bile ducts, bilirubin builds up in the body and spreads to surrounding tissue, causing jaundice. So, what is the normal physiology and the process of bilirubin? When red blood cells reaches their lifespan of 120 days, the oxygen-carrying protein hemoglobin is disintegrated by macrophages and recycled. However, the heme rings that binds the protein cannot be recycled, so it is turned into bilirubin, which is lipid-soluble compound, and it is transported in the liver um, to be converted into water-soluble compounds called biliverdine. Um, After it is converted into biliverdine, it enters the gallbladder um, in the form of bile, and it passes through the gallbladder and enters the small intestine where it is converted. The bacteria in the small intestine converts the bilirubin into urobilinogen, and the urobilinogen is converted into stercobilin and is excreted out of the body in the form of stool, and it gives stool its brown color. And some of urobilinogen enters the kidney through the portal vein and excreted through urine, giving it its yellow color. So, what are the causes of jaundice? Usually, jaundice can be an indication of an underlying medication condition. The overproduction or overload of bilirubin due to blood abnormalities, liver defects, or obstruction of bile pathways can lead to overload of bilirubin and can exceed the capacity um, of the liver, and which can lead to the bilirubin traveling to the surrounding tissues, resulting in yellow pigment in skin, eyes, and membranous mucus. So the three main causes, first one could be blood abnormalities, and the conditions such as hemolysis or hemolytic anemia, they can contribute to overproduction of bilirubin, um, and liver damage, which can disrupt with bilirubin metabolic processes, liver damage caused by hepatitis, use of alcohol, certain medications, and of course, the obstruction of bile pathway, which blocks the way for the um, bilirubin to exit through the body, can lead to the bilirubin not being able to go anywhere, but the surrounding tissues causing um, jaundice. So the symptoms are yellow skin, whites of eye, yellow inside mouth, fever, abdominal pain, dark colored urine due to too much of bilirubin, or pale stool because not enough bilirubin is being excreted, vomiting, itching, and the test that can be used to diagnose jaundice could be bilirubin blood test to see how much how much bilirubin is present in blood, or liver function test, or hepatitis virus test to see if um, liver is responsible for the jaundice, and treatments. In most adult cases, treatments are not required, specifically for jaundice, because most of jaundice is caused by other underlying medical conditions. However, in infants, it could be severe, so most of the treatments in infants focus on reducing the number of bilirubins through treatments such as exchange transfusion, phototherapy, fiber optic blanket, etc. And the risk factors are the people who are at risk are people who consume alcohol. Newborns are at high risk because their liver is not fully developed, so there could be abnormal bilirubin processes, and also people with darker skin color because it can be left undetected for a long time and can cause severe damage. Right. Thank you. These are my resources.